I'm Joe Condon. Welcome to our program. This week we're going to be talking about education, and we have with us Dr. Greg Dewey, who is the president of the Albany College of Pharmacy and Health Sciences with campuses in Albany, New York, and Colchester, Vermont. Doctor, so nice to have you with us.
Well, thank you, Joe. Thanks for having me. It's a pleasure to be here.
Tell us about the Albany College of Pharmacy and Health Sciences.
Well, the college is one of the oldest pharmacy schools in the country. It was founded in 1881 and has a long tradition, especially in New York State. Back in the day when there were independent pharmacists throughout the state, virtually all of them were our alumni. We have long traditions in the state, but pharmacy has grown and it changes, and as we move into the modern era, it's become much more complicated. So we have expanded from a pharmacy school to pharmacy and health sciences, so that we felt we needed to have a broader academic footprint. We needed to build up some aligned areas, things like clinical laboratory science, pharmaceutical science, microbiology and chemistry. So we have an undergraduate program, we have a couple of graduate programs, and the signature program is the Doctor of Pharmacy. And we continue to serve New York State and beyond as well in our Vermont campus.
Tell us about the Colchester, Vermont campus. That's a little different than the one in New York State and Albany.
Yes, so Colchester, Vermont, it's our sort of our second site. It's a smaller site. We have about 50 students per class. It's a 4-year pharmacy program. It's located in an absolutely gorgeous setting, and students love their experience there. It is a very close-knit community. The students and faculty get to know each other very well. We do some broadcast of courses back and forth so that students in Vermont can see what's going on in Albany and vice versa. But that campus is about 7 years old now, and we're really becoming part of the Vermont scene. It is the only school in Vermont, and there are a lot of opportunities for us there.
We were talking about this before going on the air. There's a little difference in the regulations for pharmacists here in New York State and across the state line in Vermont. Would you talk about the difference a little bit?
Yeah, so the scope of practice for pharmacists in Vermont is a little more relaxed than it is in New York State. They just passed a bill in the state of Vermont whose intent was to fight the opioid epidemic, in which pharmacists now have provider status. That is, they, under certain circumstances, can prescribe drugs. They have a role that gets them closer to being a primary care provider. And this is the ideal for us. We would like to see that not only in New York State, but in all states. In this country, there is a real lack of primary care, surprising as it may be. New York State has only about 45% of its primary care met. So some professional has to step in, and we think pharmacists can do that. But it takes first the legislation to allow you to do it, and then the insurance companies have to be reimbursing some of your activities. But our pharmacists they have a really sophisticated education. They know medication and therapy management like nobody else, and they can step up and really help ease this need for primary care.
I mentioned we go to the Rite Aid in Waterbury, where they have a lot of Albany College of Pharmacy students working. And over the years, because we've been going there so long, we've had advice from pharmacists. Well, okay, you're doing this, maybe you should reconsider this, or this really isn't the best prescription. You ought to go back to your doctor and ask him for that. And they're very helpful, but also too, they don't want to. They haven't never violated the law, but they have that relationship.
Well, that's the history of community pharmacy. Back in the day when it was completely independent, those independents were pillars of their small town. People would frequently come to the pharmacist before they could go to their family doctor and get them advice just about anything. But this advice is becoming more and more important just because of the complexity of medication these days. If you're over 60, the chances are you're on 2, 3, 4 medications, and that makes things complicated. There will be side effects. Some drugs don't work, aren't compatible with each other. You have 2 different providers providing for different reasons, and someone has to oversee your medication regime. This is an ideal role for the pharmacist.
Talk about a community pharmacist. You've sort of started doing that in the Capital Region. You've developed a relationship with the hometown pharmacies with facilities in Amsterdam and Schenectady, and you have the Hometown Health Center. You want to talk about the Hometown Health Center?
Yeah, so we just opened College Hometown Pharmacy. That's located on State Street in Schenectady. That is in the Hometown Health Center, which has been a federally qualified health center serving the underserved population in that region for years. And that's going to be a great partnership. It does a number of things. It allows our students to get involved in that community as an outreach. They learn how to work with a population that really is medically underserved. That's an unusual experience. But the other thing about it is at Hometown Health, they run a clinic and they want to partner with the pharmacist so that the pharmacist will be part of a professional team with the clinicians and physicians there, with the nurse practitioners. They will together work to solve problems. I want our students to see that. Because that's the future of healthcare, is to have not single people solving problems, but teams of professionals, and pharmacists are an important part of that thing. So they get a chance to actually work in the clinic and do that, but there's also a dispensing pharmacy where they learn the business of running a small pharmacy, and that's a unique experience. So this is really, I view it as a venture in social entrepreneurship. We're being a little entrepreneurial, but we're not doing this for profit. We're doing it for social benefit, and we're doing it to educate our students in a unique way. You know, it's a very different, your problem solving is very different when you have a person in front of you, a client in front of you with an immediate problem that needs to be solved, versus some abstract problem in the classroom that you can sit down for days and figure out a solution. It's a different type of thinking, and our students are going to learn that in these pharmacies. So very excited about that.
Well, now you have a licensed pharmacist who overall is in charge, right?
So there are actually 2 people in there. There is a licensed pharmacist that is in the dispensing part, in the pharmacy part, which is right up close in the waiting room of the Hometown Health Clinic. And then we will have a pharmacy practice faculty member who is actually working with the docs in the clinic. And so the students can get a experience in the dispensing end and patient care end, and they will also get experience in the clinical end. So it is really a great partnership, and we're really looking forward to it. We're going to open another one in Albany, in the south end of Albany. Want to open that this fall. It will be a freestanding pharmacy. In this case, we will have a clinical partner. I can't tell you who it is right now, but it's in the works.
We won't tell anybody.
Right. But we'll have a clinical partner, and we will be providing a suite of services: pharmacy, pharmaceutical services, clinical services, and medical education for this population. So it's really a new model of a pharmacy clinic that we think will be a great thing for neighborhoods that are underserved, neighborhoods where people have transportation issues, and it will provide a one-stop shop for certain low acuity conditions. So it's really a novel approach, but it is also a great learning experience for our students. So more to come on the Albany. That's very much in progress.
One of the things that you didn't mention, but in researching this, you also are teaching business management to the ones who work in your hometown pharmacy, aren't you?
Yeah. So we want them to be a little entrepreneurial and to think about what services can I provide in addition to dispensing of drugs. What sort of things can I help the patient with? One of them could be helping them find insurance, or helping them reconcile their meds, or helping them learn about diabetes. So we had the class, the third-year class, do business plans on what projects that we could add to the services at Hometown Health. So the whole class had to work in teams. They did a business plan. They did competitions, and it was great fun. And we may pick up one of these projects to implement them. But it gets them thinking not as thinking in an entrepreneurial way, thinking about how to be innovative and yet how to make it a sustainable operation. It's tricky.
Well, one of the things with the having to put together a business plan, they've got to learn, okay, I do this as a pharmacist, but I still, at the end of the day, if I have my own pharmacy, I'm going to have to pay the electric bill, the heating bill. And do you have special business education teachers now at the Albany College of Pharmacy and Health Sciences?
We do have a few that it's in our pharmacy administration, and they do teach them the rudimentaries, but that's something we need to expand upon. That side of education has been something that people have traditionally kind of picked up on the side, and it's so important that they really need to pick it up while they're in school. There's this whole new field called pharmacoeconomics. How can I deliver the best therapy at the lowest cost? It's easy to deliver the best therapy if expense isn't an issue. In the real world, it's what's reimbursable, what's effective, and what is available. And so this field of pharmacoeconomics is something our students they study, and it's about operating in the real world.
If someone who doesn't feel well goes to the Hometown Health Center, and the doctor at the Hometown Health Center writes a prescription, then they are able to walk right over to your pharmacy and get the prescription filled?
Right. And that's the attractiveness of it, is that often some of these folks have transportation is not easy for them, and to having to go all across town to get a prescription filled is a burden, or it could be very time consuming. So having the convenience of walking in, seeing the doctor, walking literally across the hall to the pharmacist, but then we also want to have an educational component. If someone, we may have booths set up to talk about diabetes or pre-diabetes. We may have screening areas to help people anticipate future problems. But we want it to be a one-stop shop and convenient and very sort of approachable. And that's, I think, the key, is to gain the trust of the neighborhood and get people to be comfortable being there and realizing, hey, I can get a lot of things done here at once, and this is going to be really helpful.
How has it been working so far?
So far, so good. We've been in operation 3 months. We're learning a lot. We have our first students have been rotating through the pharmacy site. Later this summer, we'll have our first students rotating through the clinics. And Joe Gambino, the CEO of Hometown Health Centers, has been very supportive, and we're building a great partnership there. So it's just the beginning, but so far it's looking pretty good. Joe
Gambino is a good guy. Where I work in broadcasting and radio, he used to be our news director. So,
yes, I hate to be filmed next to Joe because he's a pretty polished guy.
Right now in New York State, pharmacists are not allowed to write prescriptions.
Yes.
But right. If they go across the border in Vermont, they can?
That's right. With this new law, they should be able to. And some states like California, Oregon, North Carolina, you can, under certain circumstances, write prescriptions. So that's what I mean about the scope of practice.
Why do you think it would be a good thing for a pharmacist to be able to have the liberty to write a prescription as opposed to limiting it to a doctor?
It's just about, it's almost a workforce issue. Like I said earlier, the primary care is, we just have a dearth of primary care. There are a lot of unmet needs. Someone has a low acuity condition like an earache or a sore throat. There's no reason why a pharmacist with their training shouldn't be able to take care of that situation. It could really ease the system. Someone in a underserved area gets an earache over the weekend, they end up in the ER.
Right.
That's probably the most expensive thing that could happen, right? From a system point of view, it would be so much more convenient if they could go to their pharmacist, say, oh, you have an earache, I'll write a prescription, and give it to you. So we're not talking about changing the practice of medicine or high risk, high acuity conditions. You still want a physician to do it. But for certain things, there's a certain practicality about it, and it really, in the long run, will save us all money. So,
are the hometown health centers open 24/7 like a hospital?
No, it doesn't really have that sort of urgent care aspect to it. So it's a six-day week operation, and pretty extended hours. So.
Okay. And you find it very beneficial right now that someone who is a patient at hometown can go right over to your facility and have the prescription, and that's working well with the patients. And it sounds like they're very happy too.
Yeah, and the other, so the third thing, it's convenient for the patient, and it's also convenient for both the doctors and the pharmacists. They can actually talk to each other. So if the pharmacist sees something like, oh, this doesn't look right, or I don't understand why this is, they can literally walk across the hall and talk to the doctor, or if the physician was saying, like, I was thinking of prescribing this, but I know that's really expensive, maybe there are other alternatives, pharmacists can inform that decision. So it will benefit the patient in two ways. One is just the pure convenience of it, but you have a team that hopefully will be making better decisions about their medication.
What is the difference in the experience for a student working there as opposed to working at a CVS or Rite Aid?
Well, you know, we do have our students working at CVS's and Rite Aids, and those are great experiences. They have some comparable sorts of things that they do. One of the things, the two unique things about the hometown experience is access to the physicians and that interaction, and the small business aspect of it. The idea that we want the students to learn about inventory and some of these back office stuff. That at the end of the day, we want them to get involved in making sure it operates, in the black and as a sustainable business. That's an engaging thing. That's not something you just sort of rotate through. You have to be invested to get involved at that level. So the experiences in community are great experience. There's no doubt about it. We're just creating another experience that has some different wrinkles to it that I think would be real beneficial to the students.
One thing you seem to be lamenting is that you don't have as many small hometown pharmacies as there used to be.
You're going to get me in trouble here.
Okay, that's not why we're here, but
so actually we have a very interesting partnership with the Rochester Drug Cooperative. Rochester Drug Cooperative is a very old company. It is a wholesaler, and they are very, I would say, evangelical about seeding new independents, and they have actually created about 40 new independents in recent years. certainly in rural settings, independence can play a very important role, and that's the tradition of pharmacy.
Well, Rochester's been very supportive of your hometown project, haven't they?
They have. They have financially supported us, and that's been a real partnership. And we're developing a program with Rochester Drug Co-op where one of our residents will provide something called medication therapy management. So medication therapy management is a way of looking at the entire portfolio of the drugs the person are taking, making sure they're compatible, making sure the person's adherence, reconciling any inconsistencies, and making sure they're not taking too many. Maybe you can always try to lower them. So medication therapy management is important, and working with the Rochester Drug Co-op and a company in Albany, CSS, we're providing the service to independents that they can do MTM, medication therapy management, for their thing. We'll have a central phone bank where these independents, their customers, can phone in and get advice about managing their meds. And so that's kind of been a secondary spin-out of the association with Rochester Drug Co-op.
The other day I had to go to the dentist, and the dentist office is making a transition from having everything on paper to putting it on computer.
Yeah.
And one of the people in the office was lamenting the fact that I guess now in New York State they can't pick up the phone and call the pharmacy anymore. They have to do it now online. Is that correct?
I was unaware of that. I don't know. That may well be. I'm not. I don't know the answer to that. Although, electronic medical records are powerful. They have the potential to allow us. There's this whole new emerging area that we are very interested in educationally called population health sciences, and that is using electronic medical records. We can look and see how medications do across the entire population. And by mining those records, we can understand the effectiveness of that and the pharmacoeconomics of it. When a drug is approved in a clinical trial, typically you'll have 1,000, 2,000 people will take that drug for maybe 9 months, 2 years. That's a pretty large, expensive trial. That drug is approved, it can get out, and literally millions of people could be taking it for years. So how that drug performs in that population is very different than the almost scientific setting of a clinical trial. So population health sciences, population health outcomes is a really important area, and medical records are the key to that. So this is an emerging area we want our students to get into, both our pharmacy students, but we have a master's degree program, and we just opened up an undergraduate degree program in public health. This is a great area for public health folks to get into.
What would someone taking the public health major, what they learn?
Well, they'll learn...
That's not being learned now.
Well, so the history of public health has often been the history of infectious diseases,
Okay.
And now it's becoming more the history of chronic disease, or is more interested in chronic diseases. But what the new thing they need to learn is big data, how to deal with big data, how to mine it, how to ask questions, how to really be savvy with that electronic medical record, and really learning that sort of informatic end of things. I saw a really interesting study of New York State of the overprescription of antibiotics. This is a real problem. Antibiotics get overprescribed, and then you develop these resistances to them, and it's hard, especially with staff, and it's hard to knock out the resistant thing. But by mining Medicaid records, this group was able to identify county by county which counties were overprescribing antibiotics. So this is how you could imagine from a public health perspective. Then you can go into those counties and try to understand, well, who is it that's overprescribing? Why is this? And let's try to control it.
Well, there might not necessarily be overprescribing, and there could be a special, unique need in that county that isn't in other counties,
there's
right?
Potential. You have to be careful how you do these, but the thing is, it's a lot easier if you can get online and get access to electronic medical data rather than going out and doing surveys and the laborious old way of doing things. So the informatic part of it could have a very bright future, and we want to be part of that.
We only have a few minutes left, and you were talking about the difference in operating a pharmacy in the state of Vermont and the difference in operating a pharmacy here in New York State. Do you have any recommendations for all of the legislators around New York State that are watching today? Some things that you would like to see happen?
Well, we talked about John McDonald, your friend and mine, and I'm sure he would be supportive of a broader scope of...
What changes would you like to see made that you and John McDonald endorse?
Well, the thing would be to give a pharmacist provider status, just like a...
What do you mean by provider status?
So that they can write prescriptions for certain things, just like a nurse practitioner could. So that we could... and there are other things, too. There are things called collaborative practice agreements where under the supervision of a physician, a pharmacist can have a broader scope of practice. But pharmacists can handle some things that don't really need to go to a physician. And that really helps the system. If the pharmacist can be a player as well and work either in a team or under certain circumstances independently, that helps us all, because there is a crisis in primary care. We are not getting the primary care that we need, and I don't know how that gap is going to be filled. Somebody has to fill the gap, and pharmacists are really an underutilized resource.
I have about 30 seconds left. If you could briefly tell someone watching today that's in high school why they should become a pharmacist. Go ahead.
This is a great era for the practice of medicine. Someone said if the 20th century was the century of physics, well, the 21st century is certainly the century of biology. And we are seeing the impact of enormous, deep understanding of human biology that allow us to craft therapies that improve human condition.
And Doctor, we are out of time. Thank you. You were a great guest. Our guest, Dr. Greg Dewey, president of the Albany College of Pharmacy and Health Sciences with campuses in Albany and Colchester, Vermont. I'm Joe Condon. See your pharmacist and have a wonderful day.
Thank you.